Hi, in this video we are going to talk about drug treatment of asthma. Asthma is a chronic inflammatory obstructive pulmonary disorder characterized by inflammation and bronchoconstriction, which is reversible. Signs and symptoms of include cough, chest pain, wheezing, and chest tightness. There are four types of asthma. One is atopic asthma. This type of asthma is has a positive family history. One of the patient's family member may have this type of asthma, and they are basically allergic to some types of substances such as pollen, dander, animal dander, or molds. So in other type, second type, there is an intrinsic asthma which is non-atopic, which does not run in the family, and may be caused by the viruses and the bacteria. Third one is aspirin induced, and the fourth one is exercise induced. So let's see the pathogenesis of asthma. So any allergen or virus and the bacteria that are stuck into the respiratory epithelium on the cilia, they are picked up by the dendritic cells, which are APCs, antigen presenting cells. They took the antigen from the respiratory epithelium, move towards the nearby lymph nodes, present these antigen on MHC class 2 molecules over T helper, naive T helper cells, with the co-stimulation from CD28 and B7. This causes the T helper cells to differentiate into T helper 2 cells and other types of T helper cells. T helper 2 cells releases the interleukin and cytokines. This interleukin include interleukin 4, interleukin 5, and interleukin 13. What causes interleukin 4? This causes the B cell class switching. Antibody class switching means causes B cells to produce plasma cells that will release the IgE antibodies. These IgE antibodies coats the nearby mast cells which are present in the lamina propria of this respiratory epithelium. So whenever the allergen person exposed to second time to the same allergen, this allergen is again picked up by the dendritic cell, as well as it causes, or it will attach over the surface of the mast cell on these IgE antibodies. This causes the degranulation of the mast cell that releases the potent pro-inflammatory cytokine, which is histamine, as well as these dendritic cell can cause the inflammation with the differentiation from T helper 1 cell and T helper 17 and neutrophil migration. Interleukin 5 causes the eosinophil activation and proliferation, which is helpful in the allergic response. So the histamine release has three effects. One, it binds to the H1 receptor over smooth muscle on the bronchi and bronchioles. This leads to bronchoconstriction. While the histamine has a pro-inflammatory effect, which is the vasodilation and increased permeability that causes neutrophils to accumulate. Now, once we have discussed the physiology of pathogenesis of the asthma, now bronchial smooth muscle physiology, how the bronchi smooth muscle contract and relax in relation to certain factors. Sympathetic nervous system causes the release of norepinephrine, which bind to the beta-2 receptors on the smooth muscles. This causes increase in the cyclic AMP level. So this cyclic AMP basically causes the dephosphorylation of the myosin light chain kinase. This relaxes the smooth muscles and causes bronchodilation. While the leukotriene receptor, the leukotriene released by these inflammatory cells, particularly LTB4, they bind to the leukotriene receptors, cause smooth muscle to constrict, lead to bronchoconstriction. While the parasympathetic nervous system releases the acetylcholine, this binds to the M3 receptors, while and the smooth muscle contract lead to bronchoconstriction. So overall, sympathetic nervous system causes bronchodilation, leukotriene release causes bronchoconstriction, and the parasympathetic also causes the bronchoconstriction. So the anti-asthmatic drugs are also classified according to these three parameters, particularly the bronchodilators. So we want to make the bronchodilation, so we will need to stimulate beta-2 receptors. So we are going to use the beta-2 receptor agonist. Now the leukotriene causes the bronchoconstriction, so we want to make some certain drugs or administer certain drug that causes the blockage in the leukotriene receptors and blockage in the parasympathetic nervous system, or M3 antagonist. So drug classification, as we have previously discussed, these are broadly divided into two: bronchodilators and anti-inflammatory. But in this video, we are going to talk about the beta-2 agonist, muscarinic antagonist, bronchodilators. So beta-2 agonist, these bind to the beta-2 receptors and activates it, and activate cyclic AMP, as we have previously discussed. These are classified into two categories based on their duration of action. First one is a short-acting beta-2 agonist, or SABA. Duration of action is 2 to 4 hours, which include albuterol, metaprotenol, and terbutaline. While long-acting beta-2 agonists include LDAPA, which has a duration of action of greater than 12 hours, which include formoterol or salmeterol. Indication include for the SABA, these are acute asthma attack as well as exercise-induced asthma. Side effects, these side effects are generally due to the increased sympathetic stimulation because the beta-2 receptors are basically part of the sympathetic nervous system. If we stimulate the beta-2 receptor, it will have systemic side effects such as tachycardia, palpitations, muscle spasm, restlessness, and insomnia, which is basically due to the fight and flight response. While the long-acting LABA also has similar side effects, but their indication is for the asthma prophylaxis or long-term treatment of the asthma, and to prevent further future attacks of the asthma. So side effects include, these are similar to SABAs, but they are exaggerated, such as tachycardia can lead to the arrhythmias. Now, moving toward the muscarinic antagonist, these bind to M3 receptors competitively, block acetylcholine from binding, prevent smooth muscle constriction, lead to bronchodilation. So drugs include ipratropium and tiotropium. These are basically divided on their duration of action, short acting and the long acting. For the duration of action include 4 to 6 hours, while for the long acting duration of action is 24 hours. Indication, they are given with LABAs, which causes the additive effect and release certain more symptomatic relief, while they are also given for the treatment of COPD. So side effects basically include tachycardia, dry mouth, restlessness, pupil dilation, urinary retention. Now, because the M3 receptors are part of the parasympathetic nervous system, if we block the parasympathetic nervous system, the sympathetic nervous system will override or will be exaggerated, and the side effects will be due to the over or exaggeration of the sympathetic nervous system, which include tachycardia, dry mouth because salivation is also a parasympathetic response, restlessness, pupil dilation also sympathetic response, and urinary retention, which is also a sympathetic response. Now we want to make a simple and a fun mnemonic that help you efficiently memorize all these pharmacological facts. So let's have a two-headed bee for the beta-2 agonist. So, and a three-armed musketeer, which carrying a shield in each arm to represent muscarinic antagonist that blocks M3 receptors. So the bee is relaxing with a tall friend and a short friend. His short friend is Albert Einstein, so which stands for albuterol. He is very self-conscious about his height, so he is wearing a turban on his head for terbutaline. And on top of that is a metal helmet for metaprotenol. Next to him is a wheezing jogger. To help you remember, SABAs are used for the symptomatic relief for during asthma attack, acute asthma attacks, as well as exercise-induced asthma. So next are the LABAs, and there is a very long salmon for salmeterol, wearing a formal wear for formoterol. For indication, let's have a cough for COPD and a no smoking sign for asthma prophylaxis. For side effects of beta-2 agonist, there is a very angry raccoon to represent sympathetic response. He is sitting up in a bed because he's too angry to sleep, and his little heart is about to pop out of his chest, which indicates tachycardia and insomnia. Next are the muscarinic antagonists, which will be represented by two tropical palm trees. So since they have tropium in their name, the shorter tree has a red in it for the shorter acting ipratropium, while the longer tree has ties hanging off it for the long acting tiotropium. Since they are more effective for COPD and less effective for asthma, let's have a buff cop holding a tiny smoke sign. For side effects, let's have a girl who is in love with a musketeer. Her heart's beating faster, she's got dry mouth, and her pupils are dilated, as you can see here. In fact, her eyes are almost popping out of her head, which represent the contraindication for people with glaucoma. So this was the end. Thank you for watching. Like, share, and subscribe this. We'll see you next.